Greg Bain on advanced manufacturing surgical training models for shoulder surgery. The models are on a platform which enables them to be manipulated to the position for the comfort of the surgeon. A deltopectoral approach is typically performed. The subscapularis is then released. Sutures are placed into the subscapularis to allow it to be retracted and expose the anterior aspect of the shoulder. We can release the middle glenohumeral ligament and excise the labrum and perform a circumferential release to allow exposure across the posterior aspect of the shoulder as well. We can insert retractors in position which will retract the rotator cuff and allow exposure of the humeral head for reaming using the commercially available resectors and reamers. Osteotomy jigs can be used to ensure that we have appropriate osteotomy plane, or this can be performed as a freehand. The bone is very similar to that of a normal patient, and we can perform reaming, broaching, and all of the standard aspects of performing an internal fixation or insertion of a prosthesis. Once the prosthesis is seated into position, we can then ensure that the prosthesis would be stable. So this is an important surgical skill which can be then translated to the clinical practice. We're now performing a reverse total shoulder arthroplasty. The reamers can be inserted and we're able to debride any of the loose labrum as required. It teaches the surgeon how to appropriately apply the retractors and all of the critical steps in performing the insertion of the humeral component and glenoid component. Enables the surgeon to become comfortable. And finally, the stabilisation. So there are two glenoids currently available, basically a neutral glenoid, and there's also a retroverted glenoid of the order of 20 degrees, which is ideal for training with a B2 type glenoid. So we can see here with a B2 type glenoid, a different type of base plate is going to be inserted with an associated wedge. It enables the surgeon to practice the extra exposure required and also to use the appropriate reamers that may be used for this type of retroverted glenoid. We can see here that the wedge base plate is inserted. The appropriate skills that are required to insert this sort of prosthesis can be trialled in this environment. Here's an example of the model. On the right is actually a 3D CT scan of the model, and we can see there's a fracture proximal humerus. By incising the periosteum, we're able to create a displaced fracture. So if we look here in this example, it enables the surgeon to be able to trial all the concepts of inserting a humeral and a glenoid component, whether it be osteoarthritis, retroverted glenoid, or in this case a fracture. So all of the suture management, which is critical to understand, particularly in this type of fracture, can be trialled in this particular. So the arthroplasty models, they vary with regard to the different types. We can also use them for a fracture, a B2 glenoid. It's important for the haptic components of the arthroplasty and insertion of the prosthesis and all the surgical exposures that are required. It can be used for the full spectrum of clinical cases, from fractures, anatomic reverses, reconstructive surgery, and even custom prostheses. I think you'll find this a real advance in how to train surgeons in using shoulder arthroplasty varying from the very basic through to the very advanced aspects of shoulder replacement.